Thank you for coming again. This is a different location from where we usually have our press conferences. We did not have the Accelerate SC meeting today, but I assure you that all of the members of that group, as well as those assisting, are working and consolidating information and recommendations. Today we have some announcements to make, and that is effective Monday, May the 4th, I'm removing the home or work order as a mandatory order, removing that order, and that means it will then be, as of May the 1st, will be voluntary. It went into effect on April the 6th, and it will go out of effect on Monday. Also, I am removing the order to allow for outside dining on site at restaurants in those places, in addition to the takeout and delivery service that we had allowed in the original order that restricted them back in April. What they will do is follow the guidelines that have been issued by the South Carolina Restaurant and Lodging Association. They have a lot of guidelines on the number of seats, the distances between the seats, where the menus go, all those sorts of things to provide, and signs alerting the customers as to the precautions that are being taken and the efforts at cleanliness and hygiene that are being implemented in those restaurants or in those facilities surrounding the restaurants. And we are confident that our people will be able to implement those guidelines and have good service outside of those restaurants. Also, I'm removing the restrictions that we'd imposed on short-term rentals from the hot spots. Notably, they were listed by the CDC, the Centers for Disease Control. You remember there was a domestic travel advisory that was issued for people in New Jersey, New York, Connecticut, and the city of New Orleans because they were hot spots. You remember the very high rates of infection as well as deaths in those places. And so the Center for Disease Control issued domestic travel advisory asking people in those states and that city to stay at home and not travel outside of the state. So that has now been removed. So therefore, we are removing our restriction on the short-term rentals that was based on that finding there. Also, we're removing the self-quarantine order that complemented that required people traveling here from CDC hotspots to quarantine for 2 weeks when they came into South Carolina. If they left before 2 weeks, of course, they were out of the state, but we had that 2-week quarantine, and we're removing that as well. And that is removed right now as we're speaking. Also, I have issued a proclamation, State of South Carolina Governor's proclamation, calling for a statewide day of prayer this Sunday, May the 3rd. I think, and I know others agree as well, that it's time that we pause. We thank God for where we are, for our lives in South Carolina. We want to recognize and console those who've lost loved ones, those who are yet to lose loved ones, friends, families. We want to thank the families of all those who've stood tall also with our first responders, the healthcare people, the doctors, the nurses, the assistants, and all of those, the deputies, the sheriffs, the firemen, and all involved who have worked to keep us safe under very stringent conditions in our state. And also we want to pray for our future, which we know is very, very bright. We have been blessed in South Carolina, and we need to, every now and then, it's very important that we as a state stop together and realize it. So we're calling on that day of prayer in South Carolina on May the 3rd. We will be having future decisions to make about dine-in restaurants, dine-in service, about the close contact professions in the work, the services, the barbers, hairstylists, spectator sports, things of those nature, theaters, concerts, all of those will come in due course, and it will depend on a number of things, including, of course, the limitations imposed and the guidance by the United States Constitution, but also the compliance and the behavior of the people of South Carolina. I am very proud of the way that our people have responded to this emergency, to this contagion. Our state has done very well. It has been recognized by the President, the Vice President, and other states as well. And we can depend on the common sense and the integrity and the family nature of the people of South Carolina to do what we think is necessary. So we will be making those decisions as soon as we can, as quickly as we can, as we accelerate get our economy accelerating where we all want to be and where we were before this contagion got here. As you remember, we had the lowest unemployment rate in the United States. Business was booming, and it will boom again. We have had enormous leadership and cooperation by people all over the state, and we appreciate it very much. So the next decisions, we hope to make them soon, but we'll be watching very closely the data, the compliance, the information we receive, and the successes as they are noted coming next week from these actions and others that we have taken before. With that, Dr. Bell.
Thank you, Governor. Good afternoon. We're reporting 160 new cases of COVID-19 as of today, which brings the total number of people confirmed in South Carolina to 6,258. Unfortunately, today we're also reporting 12 additional COVID-19 related deaths, and this brings the total number of people who have died and have also had a COVID-19 infection to 256. As you know, we have asked South Carolinians to make great sacrifices through social distancing, closures, and other methods to reduce the spread of COVID-19, and the steps we are taking collectively have been working. We're continuing to provide the most current data about COVID-19 in our state, and we'll consult daily with our state partners to offer guidance based on that data, as well as federal recommendations with the Centers for Disease Control and Prevention. And our data indicate that South Carolina's COVID-19 curve appears to be beginning to level. However, the number of positive cases, while it's plateauing, we're going to continue to monitor that. We don't know what the upper level of the curve is, and we do know that many who are infected are not yet being tested. And I know that many are waiting for a time that we can fully loosen all restrictions, and so am I. And there's really no set time that I can give or a date that is a magic number at which time we can give that full loosening of restrictions. Public health data and other factors will help drive these decisions that are very difficult. And in public health, we will continue to monitor to help follow a measured approach towards relaxing these restrictions. And it's critical that everyone continues to follow the recommendations and the guidance to protect ourselves and to prevent spread in the community. And it's also critical that we intensify our efforts to decrease ongoing transmission, and to do that we're focusing on two key areas. That is enhancing testing in the community as a whole and in areas of increased risk for ongoing transmission in group settings, and that we're also going to enhance our efforts to conduct contact tracing for contacts to illness. DHEC and its partners across the state are working on a plan to enhance testing, and particularly in areas where people are underserved or have a lack of access to care. This means that we'll need to increase our contact tracing, and contact tracing involves identifying all of the positive cases, interviewing those cases, and finding out who they have had close direct contact with, so that we can then notify those individuals of the measures that they need to take to monitor for illness and to prevent additional spread from individuals who have been contacts of known cases. This extensive contact tracing process helps cut short the transmission of disease in our communities. And as part of our COVID-19 response, we have actually surged our number of contact tracers from approximately 20 to over 200 who can help with that effort. An additional point is that the elderly and African Americans are being disproportionately impacted by COVID-19 complications. The reason that African Americans are disproportionately impacted is because they also suffer from a disproportionate effect of cardiovascular disease, chronic lung disease like asthma, diabetes, hypertension, and other issues. And so it is the health disparity that has chronically existed that puts African Americans at higher risk of also suffering complications from COVID-19 infections. And we therefore recognize that there's a critical need to address these inequities. And to reach communities at higher risk, we are collaborating with our state and local partners, including local churches, housing authorities, the State Office of Minority Affairs, and the Office of Aging, as well as healthcare providers who currently serve these communities. And while we've been working to enhance our outreach efforts, we need to do more. And we are exploring new ways to reach these high-risk groups, including those partnerships that I've just mentioned, and also working to create more medical homes to provide services so that those chronic conditions can be better controlled with access to care. In addition to testing, the steps to stop the spread of disease and to flatten the curve are those that we always mention, and that is to practice all the protective measures in the community, to wear masks when you're in public, to social distance, to avoid large groups, to limit public activities unless necessary as much as possible, to observe good hygiene, and those are all measures that we will continue to reinforce to reduce the risk of exposure and ongoing infections in the state. So thank you.
Thank you, ma'am. Does anyone have any questions? Yes, sir, back there. Yes, ma'am.
I wanted to ask the restaurant reopenings, at least the outdoor portion, is
Yes,
that
ma'am.
also on May 4th?
Yes, ma'am.
I want to just get clarification on
Yeah,
that.
that's on Monday.
Okay.
Monday. Yes, ma'am.
My question is for Dr. Bell. The restrictions that have just been lifted today by the governor, do you believe that now is the right time for these specific restrictions, such as allowing outdoor seating, or do you think it's too soon?
Well, our role in public health is to monitor for disease activity. It's to make sure that we have surveillance systems so that we can detect cases when they occur, and that when those cases are identified, that we can take measures to prevent the spread of disease. So we will continue to monitor the data that shows us what the disease activity is in the communities and to provide that information to the governor's office. But our primary role is to make sure that we have the best possible disease prevention measures in place so that we can identify cases, that we can conduct the contact tracing that I mentioned so that we can do all that we can to identify those who have been exposed and prevent additional spread, and that we also have in place measures to enhance our disease surveillance so that we can detect any hotspots, any potential clusters of cases, and that puts us in the best position to be able to respond to disease activity, and that's our public health role.
Dr. Bell, how long will it take for us to see the effect of reopening restaurants or for outdoor dining?
Well, our current disease curves that we're monitoring that are showing a plateau or a flattening now, I've said repeatedly that those are all based on how well we do in the community in terms of following the recommendations that I have just discussed. And so what that curve looks like will depend entirely on people taking all the measures to protect themselves and to prevent spread in the community, to wear masks, practice social distancing, avoid large gatherings that can increase the spread in large groups. And so those practices are what will frame what that curve looks like.
Also, is there going to be any kind of enforcement measure by the state, by DHEC, to make sure restaurants are following 8 feet behind between tables, that there's no more than 8 people per group?
Well, we are making sure that all the businesses, depending on whatever type of business it is or whatever service they're providing, is that we are giving them the best guidance to reduce the risk of exposures in those settings. So we're working closely with restaurant, not directly with restaurant owners specifically, but with business owners and organizations that represent businesses to make sure that they have the guidance about the appropriate spacing of tables, that they have recommendations for how their staff can provide services most safely to protect the employees and their patrons. And so again, our role is to provide that guidance to make sure the businesses can have in place the best practices to prevent disease spread in the community.
Dr. Bell, how possible is a surge of this virus if too many people come out at one time in different locations, even just walking down the sidewalk? Is it possible that we could be seeing a surge in just a matter of weeks if that was the case?
Well, we know that this is transmitted from person to person. So when people come in close contact with each other, and if they're not observing the protective measures, there's obviously that there's a risk of ongoing spread. That's one factor, but the other factor is that we're making efforts to increase testing. And as we test more people more widely, we expect to find more cases because we know there's still disease transmission in the community. And we'll monitor those positive cases based on the total volume of tests that we're performing, and that will tell us more about actual disease activity and whether there's a real change.
Question about the restaurant protocols. Have those been outlined and given to restaurants in terms of how they do this outdoor
Yes, ma'am.
seating?
They're on the website of the South Carolina Restaurant and Lodging Association, and they're very, very thorough. And I'd also add that since this virus has appeared, we now know there's some things that have changed. We now know the dimensions of the virus. We know how it spread. We didn't know exactly how that worked before. We know that. We know its persistence. We know much more about it now than we did back in early March when it first appeared in South Carolina. And another thing, having gone into this with the various changes and restrictions that were required, our people have learned how to do these things, and the reason for wearing a mask like you're wearing, the reason for keeping that distance, the reason for not touching things and touching your face and washing all of those things, keeping that distance. We've learned that, and we I think even the children understand it by now, although whether they'll do it or not, that is the children. But things we have become highly educated and informed on what we're dealing with, and that is one of the main things, and also the willingness to comply of the people in our state. Those are things that have allowed us to move back into where we want to be in our economy. Yes, ma'am, in the back.
And Governor McMaster, what time will these orders go into effect on Monday? Is it midnight going into Monday?
The one about lifting the restrictions on the travel coming into South Carolina are all have been lifted now. The others will be midnight Monday, midnight or 12:01 a.m. Monday.
And Dr. Bell,
Yes, sir.
Not every restaurant's going to have outdoor space.
That's right.
Are you worried you're picking winners and losers with this order?
No, sir. This was the advice of the Restaurant Association, very, very carefully and meticulously planned. There are a variety of provisions to address virtually every situation in there, and we are recommending that is what be followed by the restaurants and the people.
Are they also going to have to abide by the 20% capacity?
No, sir, not for outside dining. That's not there. But one thing that still applies under a state of emergency is that order that is that statute that was passed years ago, that if you have a group of people that are causing problems in any kind of state of emergency, that they can be dispersed, and if they don't do so, arrested. So that rule still applies across the board in the state. Yes, ma'am.
Governor, a handful of state lawmakers have been pushing the people to limit your powers, your emergency powers, saying you're not moving fast enough to reopen the economy. Have you heard anything about this?
Yes, ma'am, I've heard about it, and we have a lot of people who say we're going too fast, and others say we're going too slow, and I think we're doing it just right. If we were, it's impossible to please everybody, but I'm confident that the steps that we've taken with advice and insight of people and professionals that know what they're talking about and have among them have seen everything at least one time before, except maybe not the details of this particular virus, are giving us good information, good data, good science, and a lot of good help.
Governor,
Yes, sir. Jamie?
Close to reaching a decision on other types of businesses that
I couldn't hear you.
Other types of businesses that have wanted to reopen, gyms, hair salons. Do you know when you might lift restrictions on those?
I know that we are thinking about that and attempting to gather the information and data that we need to make and experience that we need to make those decisions. I'd like to be able to make them today and say the virus was gone. But unfortunately, we can't say that. We know that's here. But we are constantly trying to determine the best and the earliest moment to remove the remaining restrictions as fast as we can, but as safely as we can.
Dr. Bell, the DHEC models had been assuming that the restrictions would be in effect through May. Is this going to change the forecast for how the virus could affect the state moving forward?
Well, as I said, those models are based on how well the communities and individuals follow the recommendations to protect themselves and to prevent spread. And as we enhance our efforts to find all cases and carry out our responsibility to prevent disease spread and conduct contact investigations to make sure that those who are exposed are not active in the community and are monitoring for symptoms so that further spread does not go on. So again, we want to make sure that we have everything in place to be able to identify cases, to provide prevention messages for businesses and members of the community so that we can do everything that we can to prevent increases in disease activity.
Dr. Bell, you mentioned that the curve seems to be leveling out, but many have recommended that we should not be reopening businesses until we've seen a steady decline. Are we seeing any indication at this point from the data that there is going to be some sort of decline coming up here?
Well, we're seeing a flattening of the curve. And again, we will continue to do surveillance to make sure that we are identifying cases, and we cannot predict whether or not that curve will go down or when, but we just have to make sure from a public health perspective that we can find all those cases and can continue to make sure that prevention and control measures are in place.
Dr. Bell, what percentage of the population is being tested now, and what percentage do you want to get to?
Out of the total population, I can't answer that question. It's not our goal to test every single person in South Carolina. It is our goal to test people who are sick. And so there are plans that we're working on to make sure that we are adequately sampling or adequately testing all populations who might be sick. I've raised this issue about access to care, so that's why we're increasing testing sites. So the goal is to make sure that we have everything in place through new testing sites, through existing providers, to make sure that we're able to test individuals who are sick.
You said we've been increasing testing. I guess, what percentage of people are testing positive out of those who are testing?
The percent who are testing positive has been around 10% of the total number of people that we've tested.
And it's been holding at that point even with the increased amount of testing?
I actually have not looked at the percent recently.
Governor, can you
Yes, ma'am.
tell us about the data or information you use to confidently believe lifting these restrictions right now is safe to do for South Carolinians?
Well, some of the data is that it has been described by Dr. Bell and other times by Dr. Toomey. But in addition to those figures and those numbers, we're looking at compliance. We get numbers from the Department of Natural Resources and State Law Enforcement Division, Department of Public Safety, about what they see as compliance. We're looking at traffic information on the highways. And of course, we look carefully at these numbers that are announced every day with the infections and deaths. But the whole picture, the complete picture, includes the things I mentioned a moment ago, which is our understanding of the virus. We understand this virus and its spread and its capacity a lot more than we did when this began. And also the people of our state understand the things that's necessary to do in order to keep the virus from spreading. I would say that information and understanding has reached virtually everybody in the state. And it took a while for that to get out, and it took a little while for people to actually believe it. But we've crossed that threshold, and so things are getting stronger. The body of knowledge, the understanding, as well as the actual numbers themselves, when you add them all together, and also look at some of the experiences they've had in other states, and of course look at the guidance and what they think from the Centers for Disease Control. You have to consider all of those things together, and that's how we make the decisions.
And Governor,
Yes, ma'am. With the red.
I had a quick question about the home and work order as well. That being lifted, we're getting questions from people who want to know what that means for them in terms of going to lakes and parks and things like that. Is
Well,
that basically
everything, the recommendations, there were mandates there to go to work, go home, and go out for necessary things. We had all the, the businesses that were closed. We had a short list of businesses that were closed. People could go to those that were open. We asked them to go only when necessary. Don't take unnecessary trips. Try to stay at work and home as much as possible. That's still what we would advise people, because the contagion is still here. We know about it more now, but it is still very much here. And if you get close, a month ago, if you were very close to someone who had the contagion, you were likely to get it yourself, because it is an aggressive disease. Likewise, right now, if you are very close to someone who has the disease, you're likely to get it just as much as you would have been a month ago. But the understanding that we have now of it, and the measures that are now being taken, we had, I think when we started, Dr. Toomey, Dr. Bell, we had about 20-something people in DHEC that could go do the tracing, the contact tracing. When someone is tested and found to be positive with the disease, we had about 20 people to go out and try to find out whom their contacts were in order to check them out. Well, now we have over 200. That number's growing. That's not enough. We hope to get more. But things have changed, and we are very well educated on this disease, and our population is educated as well.
Dr. Bill, how can people who are interested in being contact tracers, people who have been in the medical field before, how can they get in touch with DHEC on that? Or are you looking for people like that?
We are. And we're looking at healthcare providers who can help with that, with students in training, medical students, undergraduate students. So I think I would suggest that there's a DHEC email address found on our website, and if people are interested in volunteering to help with contact investigations, off the top of my head, I would say submit that information to our DHEC email address, and someone will follow up.
Governor.
Yes, sir. Dr. Toomey?
Just wanted to add one additional part to that, because we've had a lot of people reach out to us. We've been talking to school teachers, we've been talking to furloughed healthcare workers, but also pastors. The faith-based individuals are very interested in helping in many different ways. So I think we have not a surplus, but we have many people that are wanting to participate and help. And the other thing that is very beneficial is the Association of State and Territorial Health Officers. We were just talking about it a couple of days ago, and they distributed a online teaching guide for tracers. So instead of us having to develop our own materials, our association distributed to it. So that's going to help facilitate our efforts to continue to add individuals to help us.
Two more questions. Governor, a lot of rallies being held around the state asking you to reopen things. Have you felt any pressure from those types of rallies?
No, sir. There's pressure is inherent in public office. What we rely on is the advice, the guidance, the information that we receive from the professionals, which we've done throughout, the experience of people in the arena, and the goodwill and determination of the 5 million wonderful people of South Carolina.
And if cases go up,
Yes, ma'am, in the back.
As you move to reopen businesses, do you
Ma'am?
have a plan in place for if we start to see another surge or spike in the number of cases? And as well, as far as group gatherings, can there be more than 3 people in a group now?
Of course. That is one of the most misunderstood statutes probably in the law books in South Carolina. That statute is activated upon the declaration of a state of emergency. It can be for a hurricane, a tornado, a virus, or anything, a war, riots, anything else. And I was not there when the statute was passed many years ago, but they set the number as if 3 or more people are causing problems. And that could be for a crowd of 100, a crowd of 1,000, or a small group of 3. Yes, that is in effect now. Is in effect every time there's an emergency declaration, state of emergency declared. But it's not aimed at people, 3 people. It can be used if you have 3 that are threatening the health of others. But typically, it's used for larger groups. Yes, Jamie. Did Jamie?
Well, the 3 groups, but the actually, I mean that's basically the question I had. That's fine.
I got it. Yes, ma'am.
One last question. If cases do go up, do you anticipate issuing another work from home or stay at home
We'll
order?
cross that bridge when we come to it, and we'll be very careful as we have been. We do not expect that to happen. If it does, I assure you we can ramp up quickly. We know how to do it. We've gone through it this far. The people, the lines of communication are set. We've had a lot of experience with this sort of thing, unlike some other states, because it seems like we have a hurricane just about every year. So it's the same network of people, but with more health authorities involved this time. So now that we've been through this, if it's necessary, we'll be able to ramp back up. We hope it's not necessary. Again, as Dr. Toomey and Dr. Bell and everyone else has said from this podium and the other, if we all follow those rules, follow the guidelines, watch that social distance, and do all the things that we've been told to do. And Mother's Day is coming up. Your mama told you to wash your hands and cover your nose and mouth if you cough. As long as we do those simple things and use common sense, we ought to be just fine, because we're taking very carefully calibrated and deliberate steps to protect the safety. And as Dr. Bell has said, health, that is your physical health and economic health, public health, are all the same thing. They're all part of the same package.
Thank you, guys.
Thank you.